welcome to Spear Medical. I'm Eric. Today we're going to be looking at our explaining series. So this is the first episode and we're going to explain asthma, how it occurs and also some of the common treatment options for it. So we'll start first of all with a quick remind and revise of the anatomy and the structure of the respiratory system. In this case, the lower respiratory system is what we're going to look at. So, as you can see, it starts here at the larynx. We then have the trachea. The trachea then splits into two, into the left and the right lung. We then have the primary bronchus, the secondary bronchus, the tertiary bronchus, before we hit the bronchioles and the terminal bronchioles. This line down here represents the diaphragm, which is obviously one of the main muscles of breathing. And this is the front view of the lungs with the left here and the right here. So, asthma is an overreaction of the body's sort of natural defences, if you like, of your body trying to get rid of something it doesn't like. So it's a reaction usually to an external stimulus, and this reaction causes narrowing of the airways. Now, it's not just any particular part of the airways. Actually, as you can see here where I've drawn this yellow line in the circle, it's primarily concerned with the bronchioles. So what we have here is a normal, healthy bronchiole. So this is a cross-section view of it. And what we have is just a normal bronchiole that allows air to go in and out of it as normal, that allows air to get right to the alveoli, the end of the lungs where gaseous exchange occurs. In asthma, the same bronchioles become inflamed and narrowed in response to some sort of external stimulus. Now, this external stimulus can be different for sort of different people. You can have exercise-induced asthma. You could also have asthma that's triggered by hay fever, allergens, pet hair and things like that. But either way, we get this narrowing occur of the airways and less air is able to get in. But more importantly, and quite specific to asthma, air also can't get out. So we get a little bit of oxygen getting down to the lungs, but we get this inability to get rid of carbon dioxide, which causes all sorts of bizarre metabolic disturbances. So these are your bronchioles, and like I said, this one's healthy and this is a bronchiole with asthma. Now, I said it's quite sort of relevant that I mentioned that it's specifically the bronchioles rather than me just saying it's your airways getting narrowed. And that's because actually when we look at your bronchus and your trachea, so here, your bronchus, your primary, secondary bronchus and your trachea, they're actually given structure by this C-shaped cartilage. So if this is one of your primary or your secondary bronchus or your trachea, what you get is, on the inside of it, not on the outside, this C-shaped cartilage that goes around the structure. And actually that prevents them from collapsing, so that holds them rigid unless they're subject to sort of any sort of direct trauma. These rings protect the airway from closing in on itself. We actually lose this as we get down to the bronchioles, and they're just held open with muscle. So we don't have this protective C-shaped cartilage, so they're particularly prone to narrowing and sort of closing off entirely. And that's what we see with asthma. Now, some of the signs and symptoms that we can see with asthma is obviously shortness of breath. So signs and symptoms, shortness of breath, SOB. We're going to see wheezing, or hear wheezing, should I say. Now, this might be audible without using a stethoscope, but if you were to use a stethoscope, then you would definitely expect to hear it, particularly when the patient's breathing out. So as you're listening to the chest, as they're breathing out, you'd expect to be hearing that wheeze, but it can be biphasic, so you could hear the wheeze when they're breathing in and also when they're breathing out. We're also going to see potentially some bluing of the extremities. So this would be things like your lips, nose, and nail beds. And we call this cyanosis. If we're using oxygen saturation monitoring, so that's the probes that we attach to fingers or ears to measure the percentage of oxygen in the blood, then this SpO2 we would expect to be lowered. So that's a couple of the symptoms. There's obviously more, all that you'd expect to see in somebody sort of struggling to breathe, not speaking in full sentences, potentially altering their position so they can breathe more easily, etc. From a treatment point of view, we need to let the patient find a position that they are most comfortable in. So what we don't want to do is start trying to restrict their breathing or restrict their positioning, tell them what they should or shouldn't be doing. Ideally, they want to be sat up with their back sort of open and being able to sort of draw in as much air as they can, if you like. So we want to make sure they're comfortable. If they have their own inhalers, we want to encourage them to use it. So usually in the UK, that would be a blue inhaler, salbutamol usually, and we want to encourage them to be using that. We're obviously wanting to call 999, or if you are a medical resource and you don't have a paramedic or a doctor with you, then we want to be thinking about getting that backup brought to you as quickly as possible. If you carry oxygen and their oxygen saturations are low, we can consider administering oxygen through a non-rebreather mask. Again, that's obviously all dependent on your skill grade, really. And that's really it. Like I said, a whistle-stop tour of asthma. A little bit of the normal anatomy, a little bit of the abnormal anatomy, why it affects the bronchioles and not the sort of upper airways, a couple of the signs and symptoms, and some of the treatment at a basic level. As we move on to sort of more advanced treatment, we'd obviously be considering things like adrenaline, other inhaled drugs such as ipratropium in the UK, and obviously getting the patient to definitive care, fully expecting, if they're not responsive to treatment, them to deteriorate into cardiac arrest, and where we also might need to start treating things like tension pneumothorax. So I hope you found this helpful. Like I said, it is meant to just be a brief introduction to explaining what asthma is and a couple of the signs and symptoms and some of the really basic treatment. I hope you found it helpful. Thank you.